Hi, I'm Dr. Nwaeze, a sports medicine specialist in Southeast Wisconsin. Today I will be discussing shin splints. Here is x-rays showing the anatomy of your shin. This big bone here is called the tibia, while this bone here is called the fibula. When we talk about shin splints, we are focusing on this bone here called the tibia. There are muscles that actually sit in front of this bone and attach at different portions to the bone. And when we say shin splints, we mean inflammation of those muscles where they attach to the bone. Now we are going to talk about the causes of shin splints. There's three main categories that we will look at today. One is overloading principle, number two is biomechanics, and number three is shoe wear. So let's start with number one, overloading principle. So when you run, you put a lot of stress on the muscles aligning your shin. When you strike the floor as an impact, there's ground reaction forces that essentially cause irritation of the muscles outlining the shin. And depending on how much running you do, for example, that can cause even more stress. So, for example, somebody training for a marathon who is trying to run 26.2 miles, that certainly can put a lot of stress on your shin, causing shin splints. Number two is the biomechanical issue, and that has to do with the alignment of your feet, for example. So if you're flat-footed versus if you're high-arched, that certainly can change the stresses on your shin, and that certainly can cause a lot more pain in the shin. Number three is the shoe wear. If you have shoes that don't have good supports, especially for your arch, that can also cause issues with your shin. And that has, again, to do with the impact part. Good supportive shoes will tend to absorb a lot more impact than shoes that don't have a lot of support. Now we will talk about treatment for shin splints. The first thing we always recommend is the RICE principle: rest, ice, compression, elevation. So ice massages, where you can use either an ice cube or a styrofoam cup that is frozen, and then going back and forth will help. Usually about 20 minutes on, 20 minutes off, or as much as you can tolerate. The ice certainly helps to decrease inflammation. The other treatment is obviously rest. The running activities or even brisk walking certainly will aggravate it, and you will need some time off. You don't always have to be totally off as far as activity. You can always cross-train, which means swimming, using an elliptical machine, or even riding a stationary bike or a regular bike. The next thing is looking at your shoe wear. If you have shoes where you've essentially worn down the inserts, or you have essentially no support, then we recommend that you get new shoes. For runners, typically you're looking at every 250 to 500 miles of use, and then you have it replaced. Orthotics, which is certainly something that we talk about, or shoe inserts, certainly can help you, especially if you're flat-footed, to help raise your arch, again helping to redistribute the forces in the shins so that your pain is less. And then lastly, we'll talk about other types of things that can present the same way. For example, if you have pain in your shin after trying all these things mentioned above, then you might have a stress fracture. And if you notice an area of pain that seems to bother you even when you're not running, you should seek medical advice. Also, there is a condition called compartment syndrome, and certainly that can mimic shin splints. If you have any indication that your pain is not improved with the measures we outlined above, then you should also seek medical advice in that regard. Thank you.